The October 26, 2011 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews, Mr. Daniele, Ms. Cayley, Mr. Lightfoot is excused, Dr. Quattro, Mr. Racco, Chairwoman Draw,
Here.
President Adair.
Is there anyone signed up for the public forum?
There are 6 public forum speakers signed up this evening. When I call your name, please come forward and address the committee, and you will have 2 minutes in which to share your remarks. And please conclude when the timer sounds. And we thank you for your cooperation. Our first speaker will be Mary D'Alessandro.
With 2 minutes, I'll be able to say my name. Good evening. I'm Mary D'Alessandro, President of the New York State Coalition of Property Owners and Businesses. I have also worked on the lead committee of the New York State Coalition of Property Owners and Businesses to help develop a reasonable lead ordinance in the city of Rochester to ensure lead-safe environment for tenants. The reason that I'm here is I received an email yesterday that brought to my attention on 3 things that the lead coalition was asking for. First was a statewide requirement for housing to be inspected for lead. That is absolutely unreasonable. In 1994, we had 5,680 children poisoned, and today we have 283. An award should go to the County of Monroe Health Department. They did a wonderful job teaching the housing providers how to deal with the situation. We will never eradicate lead until we have everybody in the mix, and that is the parents. The parents need to help to keep their children safe. I have 7 pages here. I'm only going to hit the bullet, all right? There's all facts. The facts are in the numbers. We have 283 children poisoned, reduced from 5,640. 95%. The housing providers did one hell of a job with Monroe County's help. The Lead Coalition also wants 2-year inspections of single-family and in 2-unit houses. That's unreasonable. They want it every 2 years. Right now, they're every 6. Number one, where did they get their numbers that it's coming from them when we've only had 12,000 children tested out of all of the city, out of all the kids in Monroe? We need better testing, and we also need the parents involved. Everything is there with the facts. I know I have to stop, but they're facts. There's no activist crap in here, all right? New York needs to stop.
Thank you, Mary.
Thank you.
Our next speaker is Joan Roby Davidson.
Good evening.
Good evening.
My name is Joan Roby Davison, and I'm here as a member of the board of the Coalition to Prevent Lead Poisoning. I've been a member of the board and past chair since, 2001. It seems like forever. The county and the city of Rochester have been models nationally for their cooperation in addressing the issues of childhood lead poisoning. One of the commitments made when the city enacted its ordinance was a partnership with the county to do the testing. Lead poisoning is 100% preventable, and we need to identify where the risks are before children are harmed rather than trying to address it after they are irreparably damaged. Lead is a neurotoxin. It also has other health effects. There's an old commercial, pay me now or pay me later. $440,000 seems to me a remarkably small amount of money to prevent lasting harm to children. And if we as a community value our children, we will make that very, very small investment to keep the testing possible of homes in the city of Rochester. I would agree with Mary. Testing rates are still not where they should be, although Monroe County is ahead of many of the other counties in New York State. We don't really know how big the problem is or is not, or if it's just mostly focused in the city, or if there are issues in rural and village areas. And so the testing of children needs to increase as well. But the issue today that this group is looking at is, or you will be looking at for the upcoming budget, is how do we continue to test, especially 1- and 2-family homes where the vast majority of poisoning occurs with small children. Again, pay me now, pay me later. The cost to our society if we do not prevent childhood lead poisoning is seen in increased special education costs, increased violent behavior, acting out, and recurring health problems. I thank you for your time. I would like to also thank the health department for the amazing amount of work that they've done in partnering with the city and with the organizations working to end childhood lead poisoning. Thank you.
Thank you, Joan.
Our next speaker is Ralph Spezio.
Thank you.
Okay, I'll take them.
Thank you.
Thanks.
Good evening. Thank you for the opportunity to speak to you regarding a very important issue for children. As principal of the School 17 from 1990 to 2002, I can say that this elementary school has some really severe challenges. And, but in response to those challenges, Governor Pataki in the visit really proclaimed our school as a state model. But I still had a core of children with very, very severe learning and behavior problems, I can tell you. And many of these children were coming from really good and loving homes. So I was confused by that. So I became the first principal to get access to my children's confidential Monroe County health records. And I found that nearly half of them had a history of lead poisoning. And all of them, all the special ed children had a history of lead poisoning. So right after that, I became one of the founding members of the Coalition to Prevent Lead Poisoning. Now, this invisible monster of lead poisoning creates personal havoc and real suffering on a major scale. But it's very expensive to government as well. Now I have handouts here. The cost of lead poisoning, you'll get that in a few minutes. What lead poisoning does to children, that's the other handout, and my comments are a handout also. The Coalition to Prevent Lead Poisoning is pleased that the County Health Department has committed to increasing the amount of its primary prevention grant dedicated to subsidizing lead inspections, but that represents a small fraction, about 5% of the $440,000 that's proposed to be cut from the Human Services budget. But the Coalition to Prevent Lead Poisoning has some suggestions I hope you'll agree with. The suggestions are included in my handouts for my comments. And they're very brief, they're very simple, but I think the comments will actually help the county to save and recoup about 75% of the cost. You'll see those comments. You can contact me for questions, and I have listed on the handout someone that you can ask for specific questions if you have any. I hope you agree with those comments and suggestions. Thank you very much.
Thank you, Ralph.
Our next speaker is Herman Cologne.
Hi, how you doing?
Hi. My name is Herman Cologne. I'm a landlord. I have about 125 units here in the city of Rochester. We've been in business for about 12 years, and slowly but surely, we've continued to see all these changes. One, the lead testing in particular has been very, very harsh on me in particular, and some of the other landlords here in the city. I just wanted to give my 2 cents to say that, additional regulation with regards to the lead testing, I don't feel is needed. As Mary stated earlier, we only had 285 cases in the entire city at this point. The problem has been resolved. Okay, there's a federal guideline in place that has already mandated some of the stuff that you guys are looking to do. There's no need for further regulation. And in addition, to try to do a 2-year C of O versus a 3-year C of O, and it used to be 5 years. For me, with a 53-unit building, to try to get a C of O completed takes a lot of time. And to try to do that with the lead testing, it takes additional time. It's nearly impossible to try to turn every building in my business, to try to turn a building and try to get prepared for a C of O every couple of years. It's impossible. It's nearly impossible. I just wanted to give you guys some insight to look at it from our point of view, to see the kind of work that you're putting us through. I mean, I literally at this point, I'm looking to get out of the business because of the amount of regulation that we have in this city. It's just out of control. We need to put some limits on what we're doing, and we need to be realistic. We just passed some ordinances on carbon monoxide detectors. Again, we're doing a lot of this legislation without looking at the facts and how many people are actually being impacted, and why are we requiring all of these extra expenses to the county, the taxpayer, on and on, including myself. We've been working with some of the folks at Social Services, and we mentioned the fact that the lead testing in particular in the past, when the QHIs were in place, used to take upwards of 6 weeks to place public assistance clients. That no longer is the case. And again, I feel that it's something that we need to consider very, very strongly, why we're spending this extra money to try to implement something that's already implemented at the federal level. Thank you.
Thank you, Herman.
Our next speaker is Cheryl Hurley. Our last speaker is David All.
Thank you.
Good evening. I confess that I'm not entirely familiar with the suggestions that are before you, if there's any proposed legislation, if there's anything definite. But I do want to talk about the proposal that we require a certificate of occupancy once every 2 years for all publicly assisted housing. The rough translation of that is we're going to require warrantless searches of the homes of persons on public assistance once every 2 years. I would hope that you would see a constitutional problem with that. I dropped off a chart. This is from the Monroe County data showing the trend of percentages of children tested with elevated blood lead levels from 1990 until now. Sorry, I walked up 4 flights of stairs. Had any idea the stairs were that long, I would have taken the elevator. You'll be told that there's a direct correlation between healthcare costs and crime and lead poisoning. Have you seen healthcare costs doing that over the last 20 years? Have you seen the crime rate doing that over the last 20 years? If you're going to pass any sort of legislation requiring inspections of housing, I challenge you to do the one thing that I've never seen done in any municipality. Make it apply to everyone. Make it apply to your own homes. Cindy, I've been to your house. Very nice house. I envy your house. But there's a lot of things that aren't done. You had to get a C of O? Hire a contractor. 30 days. Get it done now. Or you will be fined. My house wouldn't pass either. But that's the boat that you put property owners in when you require these certificates of occupancy. And in order to get it, you have to let someone from the government into your bedroom to inspect underneath your bed for dust bunnies. That's what we want to avoid. Thank you.
Thank you, David. The next item on the agenda is the approval of minutes. You have before you the September 27th minutes. They will stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk.
Referral 11-238
Moved by
acceptance.
Legislator Rocco, second by Legislator Quattro. Is there any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, this referral is to provide funding to the city as well as Schneider Laboratories and the Catholic Family Center for the Childhood Lead Primary Prevention Program. I wondered if someone could talk a little bit about how that funding is used, please.
Through you, Madam Chair, there are 4 major contracts that are funded in this grant. One is to Cornell, which is a contract to provide training for EPA certification for renovators, remodelers, and painters about lead-safe work practices. There's $140,000 for the City of Rochester, which is a contract for the city to implement the lead ordinance. Schneider Laboratories, $9,000 for paying for analysis of lead in paint and dust by wipe and also in soil. And Catholic Family Center, $15,000 for a contract to work with refugees who will be moving into properties that may have lead hazards in them.
Thank you. And through the chair, is this referral states the period it's a 6-month funding period? Is it the same? Is the $140,000 for the City of Rochester the same as it's been in the past? Through the chair.
It's actually 130. Through you, Madam Chair, I'm just looking at the referral from last year, which had a funding, which was a 12-month period, and it had a funding level of, Kevin, what did you tell me it was? $230,000. And so I believe that the $140,000 for a 6-month period is actually a little higher on a adjusted basis.
Thank you, Mr. Chair. Thank you. A few months ago, when the lead numbers came out for children who had lead poisoning in our community, you discussed, I believe it was you, Dr. Doniger, that there was a slight uptick in the number of children who identified from, we had been trending down, as some of the speakers alluded to, trending down and kind of bottomed out at 283 children in 2009, and then last year the number went up to 290 children in our community. At this point in time, more than halfway through 2011, do you have any sense where that figure is going for the current year?
Through you, Madam Chair, it's a big project to pull all of the data out of the lead registry. There are a lot of adjustments that need to be made, and a lot of cleaning up of the data, and we really only are in a position to be able to do it once a year. So I don't have I don't have any additional data for you today about that.
Thank you. So would we expect that data again to come out through the chair next June, roughly?
Through you, Madam Chair, I would hope that we would have it before then, typically 2 or 3 months after the end of the year. So for the last few years, we've had a special meeting with the Lead Coalition and met with them and provided them with the information. And typically that's occurred in, I think, March or April.
Okay, thank you. A couple of the speakers spoke to the fact, and I know myself and I think the other legislators received a letter from the City of Rochester indicating a potential cut in funding from the county's funding to the city of about $440,000 for the lead program. I wondered if you could speak to that.
Through you, Madam Chair, that's funding from the Department of Human Services, and I am not aware of the status of that. My understanding is that is an issue that is being dealt with as part of the 2012 budget, and I just don't know where that stands at this point.
Through the chair, perhaps is there anyone else representing the administration this evening who could speak to it? Because it's been represented several times that there's an upcoming cut in funding.
Through the chair, Scott Adair, the Director of Finance. We are in the process of developing the 2012 budget to be released by the date required by the charter, and do not have specifics to that at this particular point in time.
Madam Chairman, earlier, before this committee meeting, you had indicated that Commissioner Kelly Reed would be here this evening to speak to another issue, so I'm expecting her to be here. Is that true? Because I'm assuming she would be able to speak to her budget.
Can we get through this, do our referrals first, then we can discuss that after, please?
Yes, my question though to you is Commissioner Reed going to be present so that we can talk to this issue?
Mr. Kennedy? Maybe you could answer that question.
Through the chair, unfortunately, I just received a call from her about an hour ago. She will not be here to discuss a couple issues that she had on the agenda tonight. She sends her apologies, but she will certainly be here next meeting.
Thank you. Well, that's very disappointing because she did, there was a commitment made that she would be here probably 3 or so weeks ago. I received that letter from you, Madam Chairwoman. But I guess I have a concern in the fact that this has been represented several times about this cut. I have heard of it from more than one source. I believe the budget will be submitted to this body at least within the next 20 days. And so I find it hard to believe that no one has any idea whether or not there's been a cut in funding to the city of about $440,000 today.
Legislator Andrews, are you asking a question?
I am.
About this referral?
Through the chair, that is part of the budget process, and when the budget is proposed and provided to the legislature, that's probably the time that we can discuss that in more detail.
I look forward to discussing it in more detail at that point in time too, but it seems of critical importance because obviously that would affect, if there were a cut of $440,000 or some cut, it would affect the city in the middle of its budget year. And because we have seen an increase in the number of children who have been identified as having lead poisoning, and because when that data came out, the county indicated how important it was to kind of buckle down here to make sure that this isn't an uptick that's going to continue or a trend that's going to be reversed when we've been so successful for the past few years, actually a couple of decades of this work. So I would just respectfully ask that if there is any information at this point in time tonight that could be provided, that would be very helpful, because this is a serious public health concern as it's been described in this community for a long time now, and something that we've made great strides towards eradicating, and I'd hate to see us reverse course.
Is that a question, Legislator?
Yes.
Andrews?
It is a question.
Okay. I think it was answered. I think Mr. Fennedy answered that it will be discussed later in the budget.
And I understand it'll be discussed later in the budget, but I know the budget isn't due until November 15th.
I understand. I would like to get back to this referral. If this is for the current budget.
Yes, well, this actually
questions.
goes into the next budget year because this contains funding through March of 2012.
Right.
And so there's additional funding that the county usually supplies. And so I would respectfully request that once that decision is made, even if it is before the budget is officially submitted to this chambers, that this committee be supplied with a letter indicating the amount of funding that the city of Rochester will receive from the county. It can be separate from the budget release because I think the information could probably be peeled out beforehand. Would that be possible?
Mr. Fennedy, would you like to answer that?
Through the chair, the county executive, pursuant to the charter, will be proposing a budget. At that time, it will be before the legislature for discussion and debate. If there's any changes that the legislature would like to make, that's the appropriate time to do it. As Mr. Adair indicated, we're finishing up the budget right now, and we just don't have that information to share right now.
Thank you. Absolutely. Thank you. Can we get back to this referral then? Legislator Andrews? Any other questions regarding this particular referral?
No, I don't.
Legislator Cayley?
Thank you. Through the chair, to Dr. Doniger, I'm pleased to see the inclusion of funding for a childhood prevention program with Catholic families in reference to the refugee children that have been entering the county and will continue to enter. And I just would ask, not that you would know the full basis of what their program is doing, but could you describe it slightly, perhaps? Do you have insight into the funding that's going for that particular program?
Through you, Madam Chair, I hope that I can do this justice. But at a very basic level, there are translation services when we are dealing with a family that is a refugee family. Catholic Family Center employs a lot of individuals with knowledge about the various languages that are spoken by the refugees in our community. We put on some workshops. Catholic Family Center puts on some workshops for families. And they assist with the issues between the landlords and the refugees when there are issues related to lead poisoning.
Thank you. And one more. Is it, through the chair, is it practice to test for previous lead poisoning of all refugee children that are entering the school district?
Through you, Madam Chair, that is a general recommendation that refugees be tested for a number of things, including lead poisoning. It's not something that we do through the health department, but obviously the medical care providers in the community are very knowledgeable about this issue, and hopefully they're diligent about assuring that lead testing is done with refugees.
Thank you. I would hope so. The reason I ask is because I was looking in my small sense of the issue, a baseline that could be established as the children are entering the school district and the system here and living in the United States versus their home country and refugee countries before they enter, that it would be very advantageous if we did in fact have a baseline to go by through the next couple of years as they enter to see how well we are actually doing. I think that that's one way of getting a much better measurement down the road with how well this particular program and the rest that we do actually works within that population. Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Motion carries. Next item.
Referral
Moved by
11-239.
legislator Quattro, seconded by legislator Daniele. Any discussion on that? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-240, acceptance of a
Moved by
grant.
legislator Daniele, seconded by legislator Rocco. Is there any discussion on this? Legislator Cayley.
Thank you. Through the chair, just briefly, this is a program that's been going on for some time and is well known, and I noticed just in the text that it also covers childhood lead poisoning. I'm assuming that it would not be an overlap of services that are offered, but more or less in tandem with what's being offered?
Through you, Madam Chair, yes, that's exactly correct. We have a number of different funding streams in the health department related to lead poisoning, and we are trying to stretch the dollars as far as we can, and it would certainly not make sense for us to be in the same property doing lead assessments multiple times. So we're in this program, we're in a specific geographic area, and we make assessments of the properties and for a number of different health hazards, and one of them is for lead poisoning. Now, it is possible that some other assessments may be occurring, such as a C of O assessment, for instance, that might be done at another time, and we can't coordinate with all of the other programs in the community, but certainly within the health department, we minimize the duplication.
Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral
Moved
11-241.
by legislator Rocco, second by legislator Quattro. Any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed, item carries. Next item.
Referral 11-242.
Moved by legislator Quattro, second by legislator Daniele. Is there any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, this referral references a work plan that's to be developed between the Perinatal Network of Monroe County and the Department of Public Health. And the plan is going to identify the community need. At this point, I believe this is the third year. Yes, this is the third year for the grant. After 2 years, could you speak to what the community need is at this point for these services?
Through you, Madam Chair, there are a high number of pregnant women in our community that are at high risk for poor perinatal outcomes. I don't really have a prepared document in front of me, but we do have tremendous disparities in the city of Rochester compared to the suburbs in terms of many perinatal outcomes. We know that some of those risk factors are psychological and social, and they are not really amenable to biomedical interventions. For that reason, we believe that it's important that we have home visiting programs where people go into the community and meet the pregnant women where they live and help them with a variety of issues that could potentially impact their health: substance use, diet, getting adequate exercise, domestic violence. And for that reason, the planning for this grant has recommended that we try to do our best to stretch the resources that we have available for home visiting. And as you can see, as part of the grant, we are funding the visiting nurse service for one nurse to add to the complement of nurses that are funded in other parts of our budget for nurse-family partnership.
Thank you. And through the chair, then, how many families do we see with this program, in this referral?
Through you, Madam Chair, there's sort of two parts of the program. There's this planning activity that's going on, and then there's the service component. And for the one nurse that is funded, that's approximately 25 families per year. That's the caseload that is recommended in nurse-family partnership.
Thank you. And then the total number of families per year, I guess including the 25 new families that the new nurse will see?
The target number of nurses in the nurse-family partnership is 12 nurses, so that's approximately 300 families. We don't quite get to that number because some of the nurses have supervisory responsibilities and they don't carry a full caseload.
Thank you. The work plan is also supposed to develop evaluation criteria. What do you think that will be, or what do you use at this point in time to evaluate the program?
Please address through the chair.
Through the chair.
Thank you.
Through you, Madam Chair, the Nurse-Family Partnership is an evidence-based program, and based on a lot of research, we have a high level of confidence that it's effective. And so our focus is not on determining whether it's effective or not, but basically making sure that we're targeting it to high-risk women in our community, and also that the program is implemented in a way that has fidelity with the original model.
Okay. Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-243.
Moved by legislator Daniele, seconded by legislator Rocco. Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, how many TANF and safety net maintenance of effort recipients are employed with this funding?
Through the chair, we anticipate that this additional funding will allow us to place up to 75 additional TANF recipients into paid employment.
Thank you. And through the chair, how many do you have placed now?
I don't have a firm number for you. I will be happy to get that.
Thank you. And through the chair, do we use up all of this funding for this program?
Have we at this point used it all? Through the chair?
Yes, for job placement.
Through the chair, I'm not sure I understand the question. Is the question, have we exhausted all the funding, or is all the funding used for job placement activities?
No, through the chair, have we exhausted all of the funding?
Through the chair, no, we have not.
And through the chair, by the end of the grant period, do we expect to exhaust all of the funding?
Through the chair, yes, we do.
Thank you. And do you know by chance what the average wage is that the recipient would receive in a job under this grant?
Through the chair, we have not calculated that in the last few months, but it's consistently been in the $8.50 to $9 an hour range throughout the period of the funding.
Thank you. And through the chair, do you track the recipients? I mean, once they're off this temporary portion, to see if they continue to stay in those jobs, or after you're subsidized, after the funding runs out, do they tend to not keep them?
Through the chair, we do that on a limited basis. We look at retention periods of 90 and 180 days. The program has been generally very successful in the retention rates of over 80%.
Thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries.
Referral 11-244, amend
Moved by
resolution.
Legislator Rocco, second by Legislator Quattro. Any discussion? Legislator Andrews.
Thank you. And through you to the administration, is this Green Jobs Corps program, and again, these are temporary jobs for TANF recipients and safety net recipients, is this what we started last year?
Through the chair, yes, it is. It's a supplemental funding through the Office of Temporary and Disability Assistance.
And thank you. Sort of the same line of questioning from the last referral. Can you speak to the number of TANF recipients who have been employed with this funding and how it worked last year?
Through the chair, yes, I can. For year one funding, we placed 39 public assistance recipients into Green Jobs. So far for this round of funding, we have 9 individuals placed into training and employment activities.
Thank you. And through the chair, is the average wage similar to about $8.50 an hour?
Through the chair, I believe it's closer to $9 an hour for this particular program, but I will double check that as well.
Thank you very much. I don't quite recall correctly from last year, but I didn't think it was only placement last year for the Green Jobs program with Food Link Rochester Landscape Technicians. I thought it was more employers, but I could be wrong. Is this the exact same continuation of the exact same program that we had last year?
Through the chair, yes.
Legislator Andrews, you need to address it through the chair.
My apologies. I thought I did in the beginning of the question.
Thank you.
Through the chair.
Through the chair, yes, it's the same contract extended for second year.
Thank you. And through the chair, part of the funding goes to reimburse training staff salaries for RLT. Could you please give a breakdown of what portion of the funding goes to the training or the salaries for RLT?
Through the chair, the additional funding of the $133,553 we're receiving, approximately $17,000 of that will go to contracted staff for training.
Thank you very much.
Any other discussion? Legislator Cayley.
Thank you. And briefly, you may, through the chair, you may or may not be able to answer this, but since this is temporary and it's subsidized employment aimed at training for green jobs in the future, has the economy been able to maintain at a level that will allow these individuals that have been trained, once this program is done for them, that they would be able to move into the general employment area in Monroe County?
Through the chair, that is difficult for me to answer. I'm not an economist. I can say that 63% of the program participants who completed the training phase have maintained employment in that industry.
Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-245.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you, again, the same line of questions on this referral regarding the placement in the healthcare arena. Could you provide either today or follow-up is fine, a list of the employers where public assistance recipients were placed, and as well as the number of people who were placed last year and the expected number for this year, please?
Through the chair, yes, we can.
Thank you very much.
Thank you. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-246, acceptance.
Moved by Legislator Daniele and second by Legislator Rocco. Any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, the purpose of this $50,000 is to decrease the caseloads of Child Protective Services with an overtime project. Could you speak to the current caseload of CPS staff and then what the projected decrease will be?
Through the chair, what we're attempting to do with this project is to specifically mandate overtime for those child protective investigation caseworkers who have caseloads of more than 20 active cases.
Any other discussion?
Yeah.
Oh,
Yeah, sorry.
Legislator Andrews, yep.
Thank you. Through the chair, I'm sorry. How will that decrease caseloads overall?
We're attempting to decrease our overall CPS investigation caseload to approximately 15 cases per worker. So we're addressing the highest caseloads using this funding.
Thank you very much. And can you tell me through the chair, is there a recommended level of caseload for a CPS worker?
Through the chair, there's a distinction between a CPS worker and a CPS investigation worker, which is what I think we're talking about tonight.
Okay.
Investigation. The recommended level is 12 active cases per worker.
Thank you very much. And then our current level is what? Through the chair.
Through the chair, our current level is 17.
Thank you very much. And one last question through the chair. Is 17 what our caseload was for last year as well?
Through the chair, yes, it was.
Thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee tonight? Legislator Andrews.
Thank you, Madam Chair. I referenced it in the previous question, perhaps out of line, but I did expect Commissioner Reed to be here this evening to speak to the contract with Maxim. I noticed she's not here. Is somebody at the administration prepared to give an update in terms of whether or not we've done a review of our contract with Maxim Healthcare Services?
Through the chair, unfortunately, no.
Through the chair, is it possible that we could receive some sort of review or report in writing, perhaps before the next committee meeting, or actually before full legislature meeting?
Through the chair, I understand Commissioner Reed wanted to provide that report in person, but I can touch base with her, and that could be a possibility. If it could be put in writing without accompanying information and dialogue. I think that was her concern.
Okay, well, I look forward to your response. Thank you.
Thank you.
I have one other matter of unfinished business. Just in reviewing the second quarter key indicator report and the amount of variance that was projected for Health and Human Services ranged from negative 1.2 million to negative 3 million. And in the notes on the first page, it said the improvement from the first quarter was due to effective public assistance caseload management and projections for the rest of the year. And I've wondered if somebody could expand upon that statement and describe how the caseloads have, I guess, improved this year.
Through the chair, I will attempt to, it's going to test my memory a little bit, and if I don't get it all, I will follow up in writing to you. But effectively what happened was when we did the end of the first quarter in the key indicator report and working with the Department of Human Services and projecting what their caseloads were going to be for the rest of the year, they were estimated higher than what they actually have turned out to be at the end of the second quarter. So we had to do a reprojection of those caseload numbers, and ultimately based on what they anticipated for the second quarter didn't actually come to fruition, and so the numbers were actually down. So we reduced the caseload numbers. And specifically, I don't remember the actual numbers of what the reductions were, but I can provide that in writing.
Thank you. That would be helpful. Given the current economy that continues to kind of trickle along, it seems, and all we read about increasing demand for social services programs. It just seems hard to imagine how caseloads are dropping, but I look forward to the information. Thank you.
Thank you. Any other discussion? Then there being no further business, the October 25th meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee is scheduled for November 29th at 6 p.m. Thank you. Have a nice evening.